Good evening, gents. Today I present to you my last persuasive speech for the semester. Today I'll be talking about why I feel healthcare should be universal. And here's my audience with me today. And the cameraman, of course. Um, I'd like to talk about why healthcare should be universal in the United States and why we need to improve on our healthcare system. We need a better, higher quality of healthcare access. We need to have access to procedures that could potentially be life savings or medications, things of that nature, for especially people who are in a lower socioeconomic status. They suffer largely compared to middle class and upper class citizens. Um, and I also feel like, working Americans should not have to go in debt thousands, tens of thousands of dollars to have procedures done or, try to meet their deductibles or pay their co-pays. Healthcare has been taking a turn for insurance. Insurances, a lot of places are offering more deductibles than a copay, which is more affordable because they weighed out the numbers because that people who typically have a deductible are less likely to go to the doctor than people who have copays. So it's all a money system, and the money system hinders people from wanting to get the proper health care they need. People who have no lower income typically have free access to health care, or middle class people have access to health care, but it has to come at their expense and is not always offered the best benefits towards their health care. Especially if you have especially if you have kids too. Like if you have kids, you want to be able to, I'm sorry, health insurance can be very expensive when you have children. Your premium can go from paying roughly $20 to $30 a month just for health care, all the way up to an additional up to $100, if not more, just for one child. It can be very expensive and discouraging to want to go to the doctor. And statistically speaking, people who have access to better healthcare or universal healthcare, such as countries like Canada, people typically live longer, and people who are healthier typically are happier and live longer. And I feel like, instead of the United States focusing on the profits that we make, we should focus more on the healthcare of our individuals, because everybody should be able to have access to healthcare, whether it's a woman who has issues with infertility, or men who have issues with erectile dysfunction. It shouldn't be an extreme tens to hundreds of thousands of dollars for these things to be corrected in in our society. Secondary and the universal health care. Young pregnancies and lower socioeconomic status usually provides lower access to health care, meaning the quality of care is typically low, and they don't have access to great doctors and great hospitals and up-to-date facilities with modern technology. Universal health care is about three things: geographic access, financial access, and quality of services. And they are the quality of access is usually concentrated in urban areas. NISTER also states from the Universal Healthcare article, it we have to change the narrative because the government and FDA are looking for a check. They put things in our food that shouldn't be regulated and that aren't regulated in other countries, because they've been proven to be cancerous, and that's why you should stay away from heavily processed foods. We should be more proactive and have a country that's built more on health, because health is wealth. It's not just money. And we should, kind of build more for these for-profit organizations and allow for more access for people to come in and benefit from these. And it's been shown that Chapman from Why Doesn't the U.S. Have Universal Health Care states that the rest of the world thinks that we're selfish, that the United States is selfish and heartless, and that it's the richest country on earth, and it doesn't seem to be to look out for its own people. And from many universal aspects, from other countries' aspects, it does appear that healthcare is not a priority here. It's more of a money thing, and that's why we must change the narrative of the healthcare system and why it should be universal and everybody should have equal quality care amongst each other, whether rich or poor. Thank you.